So I'm excited to talk with you today about public health informatics. And so let's get started. So the learning objectives for this presentation are first, to understand the three core functions of public health, to be able to list the four principles of public health informatics, to state the three key elements of information architecture, and describe the four key functions of an immunization information system, and finally, to understand the importance of integrating health information infrastructure with public health. And as we go through the presentation, I'll try to highlight when I talk about these things. I don't think there's a test afterwards, though, but I may be wrong. So the way this presentation is organized, I'm first going to talk about what public health is. Some of you may know, but for those who know, it will be a review. And then some of the new challenges to public health. Then I'm going to talk about what public health informatics is. I will define it and talk about some important elements in public health informatics, information architecture, avoiding IT disasters, and give a public health informatics system example of immunization information systems. I'll talk about a few of the challenges facing public health informatics, point you to some resources that may be useful in further exploring the field, and then we'll have some conclusions and time for questions. So, what is public health? Well, public health has three core functions. Alert, that's one of the learning objectives, is to know these three core functions. So the first one is assessment. What is the health status of the community? Obviously, the goal of public health is to improve the health status of the community. So if you don't know what it is, you can't really do that. Policy development. What laws, policies, and regulations are needed to protect the health of the community? And assurance. What can be done to assure improved health in the community? So assessment, policy development, and assurance are the three core functions. But what does public health really do? So public health tries to prevent epidemics and the spread of disease, to protect against environmental hazards, to prevent injuries, to promote and encourage healthy behaviors, to respond to disasters and assist communities in recovery, and assure the quality and accessibility of health services. So I think it's helpful to compare the functions of public health with the functions of medicine or medical care. So in public health, the so-called patient, rather than being the individual, as in medicine, the patient is the population, everyone in the community. The interventions in medicine are medical and surgical care, but in public health are, as we just discussed, assessment, policy development, and assurance. The process we use in medicine is managing patients, but the process we use in public health is managing systems. The outcome we're looking for in medicine is to heal the individual. The outcome we're looking for in public health is to have a healthy community. And the data sources in medicine are typically clinical data sources and lab data sources. But public health has a huge variety of data sources, including clinical and lab, but also environmental, motor vehicle accidents, justice records, occupational safety, water quality, restaurant inspections, et cetera, many, many, many data sources, which make it very interesting from an informatics point of view. So how's public health been doing? And of course, my focus is primarily on the US. In the US, public health interventions have been responsible for 25 to over 30 years of increased US life expectancy. In the last century, this is primarily due to sanitary sewer systems, which you don't usually think of necessarily as a public health intervention. They're not run by the health department, but that is a very, very important public health intervention. Immunizations that prevent disease and infectious disease control programs. These are the pillars that have increased life expectancy. And I should mention that the public health contribution to increased life expectancy far, far exceeds the contribution to life expectancy of medical care. So, what is public health practice? Well, it's community-wide, it's prevention-oriented, it's driven by partnerships, so the health department typically doesn't do things on its own. They have to partner with other people. There are a wide variety of components, educational components, policy components, and various interventions. Interventions with both individuals and, importantly, with systems. So, public health practice today. This is a real public health surveillance system. This card that you see illustrated here, this is how still today many reportable diseases are reported to public health. Now, this is not a postcard because you wouldn't want to put this private information on a card and then mail it so anyone who sees the card can look at the information. But this kind of a card is put in an envelope and sent by postal carrier to the health department. Needless to say, this is not a very efficient and effective method of understanding the profile of disease in the community. What are some of the new challenges to public health? Well, one of the important ones is antibiotic-resistant microorganisms. We've really overused antibiotics, and as a result, we've induced mutations in organisms that resist those antibiotics, and this creates real problems in terms of control. Emerging infectious diseases such as SARS, and some of you may have even heard of COVID-19. The threat of bioterrorism or a pandemic. Public health has to detect the initial covert event, and I'll talk more about why the earliest possible detection of such an event is essential. And we really need much better surveillance, surveillance being the collection of important disease data from the medical care system. So information is clearly the core of public health, and information systems have been used for many years, but the full potential of information technology has yet to be realized. So while this is unfortunate, on the other hand, for all of you as students, this presents many, many opportunities for applying information technology in public health. We've missed many opportunities. Public health is facing serious challenges, as I mentioned, pandemic preparedness and response, and we've seen the negative consequences of inadequate pandemic preparedness all over the world, bioterrorism preparedness and response, and dealing with increasing antibiotic resistance, and also emerging infectious diseases. These are new diseases that we haven't seen before, like COVID-19. So information systems in public health typically are far less sophisticated than in medical care. Typically, we have underinvested in public health, and the resources available to build information systems have been inadequate. Typically, source data from patient care is submitted on paper, as I showed you that lovely blue card. The funding, at least in the US, for public health has been categorical. So there's funding for HIV, and there's separate funding for TB, and there's separate funding for immunization, et cetera. And so the result has been categorical systems. So you have different systems for different parts of public health, and these systems typically are not integrated. There isn't a good standard vocabulary for public health concepts, which is bad in terms of our ability to represent public health concepts in a standardized form in information systems. And there are few standards for data representation or interchange of public health information. So let's talk more about public health information. What types of information am I talking about? Well, there's surveillance data, which has to do with the prevalence and incidence of disease. It turns out, and again, this is in the US, only 15 to 20% of reportable cases of reportable diseases are actually reported, ever. The ones that are reported, typically those reports are delayed for days or weeks. The reports typically are not in electronic form, although that's improving slowly. And other relevant data is also not electronically available. Environmental data, injury data, guidelines, contacts of people, training materials. So having timely and complete electronic surveillance data is really important, and we don't have it. And we need this for early detection of bioterrorism and other public health problems. We need electronic reporting, which actually eliminates paperwork for providers. So the vision is that public health reporting should occur automatically from clinician electronic health record systems. We need complete case reporting. We don't want to hear about 15 or 20% of the cases. We'd like to know about all the cases. And we need greater flexibility. We get greater flexibility, rather, in reporting diseases and conditions when the reporting is electronic. So, for example, we could send a message to electronic health record systems saying, well, now we want to know about X, which we didn't want to know about yesterday. And so we could change the reporting rather easily. There's also potential, if we had good reporting that was timely, for rapid feedback to providers. So clinicians could have current information about community disease prevalence. So this is a graph of the disease detection process over time. And let's see, hopefully you can see my cursor. So I first direct your attention to this. This is for a given disease, the effective treatment period for whatever it is. And I've shown that traditional disease detection, where we're looking at the number of cases essentially over time, essentially most of the disease detection occurs after the effective treatment period. What does that mean? Well, we can detect these, but we can't do anything about it. If we have active surveillance, and this, of course, means electronic reporting, and we could detect the increased cases during the effective treatment period, the results will be much better, and that's the second part of this chart. So with a traditional public health response, we're going to get fatalities that look like this, and we're going to get a large number of fatalities if we detect the disease well after the effective treatment period. Whereas if we have an early warning and an informed public health response, we can save lives. And this is why early detection is so extremely important. So what are the obstacles to timely and complete surveillance? Well, of course, you have to have automation to do this. Timely electronic health record data has to be captured. The required transactions have to be standardized, otherwise we can't process them easily. The case definitions must be established, so we don't want one group of clinicians to be reporting cases using one definition and another group to be reporting them using another definition. Then those can't really be compared and combined. The public health workforce does not have informatics skills, and again, this is an opportunity for you as students to help to address this problem. And it also requires the collaboration of many organizations because, of course, the public health department is not in charge of all the clinical electronic health records. So they have to get folks to cooperate with them. So now let me turn to public health informatics. So what is public health informatics? Well, I think a good definition is the systematic application of information and computer science and technology to public health practice, research, and learning. And one of the important words in this definition is systematic. So it's not the willy-nilly application. We have to be systematic about how we do this. And if you look at public health informatics and compare it to medical informatics, you'll see that public health information focuses on populations, prevention, intervention along the entire causal chain of disease, and typically has a governmental context. Let me say a little bit more about that. So here are the key principles of public health informatics. You may remember that there are going to be 4 of these. So first is the population focus. You have to, of course, balance individual and community needs, but you're focusing on the population. Prevention focus versus treatment. In public health, we always want to intervene as early as possible in the chain of causation, preferably to prevent the entire incident. So we would prefer to prevent disease, and therefore we have to intervene long before there's anything that happens in medical care, because if there is medical care, in a sense, we're already too late. The scope of the interventions that we do in public health are very wide-ranging. So, for example, another example of a public health intervention are seatbelts in automobiles. Why? Because seatbelts prevent injury and death in automobile crashes. So this is really a public health intervention, not something that you wouldn't go to your doctor and have the doctor prescribe, I want you to wear seatbelts. This is not what doctors do in the medical care setting. And finally, public health informatics typically has a governmental context. It's typically in a community, there's a government organization, the health department, that's responsible for public health. And therefore, openness, accountability, and responsibility versus authority are key elements in public health informatics, just as they are key elements in all governmental activities. So now I want to talk about some specific ideas within public health informatics. So first is the concept of information architecture. What is information architecture? Well, information systems are very complex. Think of a building. A building has multiple floors, multiple rooms. Rooms may have different functions. Buildings have electrical systems, plumbing systems, air conditioning systems, etc. Detailed plans are required. Nobody builds a building without a blueprint, at least nobody I know. You have to make sure all the parts are aligned. So we don't want the water lines to be running inside the air conditioning ducts, or we don't want to have to run the water lines through the air conditioning ducts. We need to deal with the flow of data. And essentially, information architecture relates to flow, storage, and processing of data, interfaces to users and to other systems, and is best done with independent layers so that we maintain organizational discipline and control. So if you imagine building a house without any architectural plans, and with only general sketches as to how it's supposed to look, or only detailed diagrams for wiring and plumbing, with each subcontractor doing whatever they thought best without consulting the owner or other subcontractors, with no specialized functions for the room, so every room would have its own stove, bed, bathtub, etc., and where the house has to be torn down completely just to remodel one room. This is silly, but this is standard operating procedure for building information systems in public health, I'm sorry to say. And so this is why we need information architecture, because we don't want to be in this silly situation of having to tear down the whole system to remodel one room. So information architecture is a metaphor for a systematic approach to building enterprise-wide information systems, and refers to the totality of the data, processes, and technology. Alert, this is one of the learning objectives. Data, processes, and technology used in a given enterprise and the relationships between them. It includes databases, applications, standards, procedure, hardware, software, networks, everything about the system. An information architecture importantly returns the locus of control and decision-making to the executive level, to the public health professionals, away from the IT community. And look, you know, I'm in favor of IT professionals. IT professionals are essential, but IT professionals are not public health professionals and should not be making public health decisions. And so an information architecture allows the key decisions to remain with the public health folks where it belongs. And it provides the basis of business control over the distributed development of information systems. So now I want to turn to another topic, which I find quite interesting, which is avoiding IT disasters. And it turns out IT disasters are actually quite frequent. IT projects fail at a very high rate. In fact, looking over many years and many different enterprises, and actually many different geographic locations as well, only 1 out of 6 IT projects is fully successful, meaning it accomplished everything it was supposed to accomplish, and it was on time, and it was on budget. Half the projects are a partial success. So that means they didn't accomplish everything, or they were late, or they were over budget. But 1/3, 1 out of every 3 IT projects is a complete failure. All the money is lost. Nothing is produced. This is very frightening, especially if you're in charge of an IT project. So why is this? And I should say, this is not IT projects carried out by amateurs. These are real-world IT projects done by well-educated, experienced people. So what are the sources of risk? Well, I think the most important one is that an IT project has a very high level of abstraction. Human beings are not designed, our brains are not designed to hold simultaneously all the elements of a complex IT project and understand all their relationships. It's just not possible. Our brains don't do that. Another problem is unrealistic expectations, otherwise known as magical thinking. In today's world, many people, particularly those who aren't familiar with computer systems, believe that computers can do anything. And while computers can do many things, computers are not magic. The management of IT projects is often non-intuitive. And we'll talk more about that. I believe the keys to success in managing IT projects, and again, because in public health informatics we're dealing with systems, managing IT projects is one of the common activities in public health informatics, much more common than in other areas of informatics. The keys to success are having interdisciplinary teams so that you have people on your team who are public health experts, who are IT experts, who are user interface experts, who are database experts, who are, you have representation from the folks who are going to be using the system. The requirements have to be clearly defined. And this is where many IT projects fall down. So a public health person might say, I want an immunization registry. Well, that's fine, but that is not defining your requirements. That's too high level. you have to say exactly what that system is supposed to do, when, with whom, where the data comes from, where the data goes, where it's stored. That's what requirements are about. And another technique that's very useful is iterative prototyping. So when you're working on a system, you want to, as quickly as possible, put together a prototype of what the management is saying the requirements are and show people what those requirements are. Inevitably, when you do this, the reaction will be something like the following. They'll say, well, yes, that's what we said we wanted, but we really don't need this, but we need this and that and this and that that we forgot to tell you. And that's what makes prototyping so powerful. Again, because human beings can't really conceptualize an entire system, showing people what the system is going to look like helps them to figure out what the requirements should be. So my paradigm for IT project success is to think of an IT project as a behavior modification task. So modifying the behavior of both management and users. That's really what you're doing with an IT project. And you want to minimize the increments of change because if you change too many things at once, people essentially rebel, they refuse to participate. And as those of you with any background in psychology know, the best way to modify anyone's behavior is intermittent positive reinforcement. And if you don't believe me, I suggest you take a trip to Las Vegas, Nevada, the world capital of intermittent positive reinforcement, where people travel from all over the world to lose money based on intermittent positive reinforcement. So what you want to do in an IT project is provide real benefits to the users, not the supervisors of the users, the people who actually are the users of the system, and give them what they want, not what you want. It's always tempting as an IT professional to build the system in the easiest possible way, but if it's not what the users want, it's a waste of time. It's not going to work, and you're headed for IT failure. So I want to spend a couple of minutes on an example of a public health informatics system, a type of system, immunization information systems. These are person-centered immunization databases. The impetus for building these systems was a substantial measles outbreak from 1989 to 1991, where there were 60,000 cases and 135 children in the US died from a totally preventable disease. And this was horrifying. So as a result of this, the idea was promoted to have immunization databases so that we can assure that all children are fully immunized against preventable diseases. So the functions, alert, this is another one of your learning objectives. The functions of an immunization information system are to accept immunization data, to provide online secure access 24/7, to generate vaccine forecasting and decision support based on deduplicated records. What do I mean by this? Well, when a child comes in for a visit, you want to know, based on their immunization history, what immunizations do they need today, and when do they need to come back for their next set of immunizations? And finally, to support immunization coverage reports. In other words, we want to know in a population, are 100% of the children age 6 fully immunized? So here are some of the informatics issues involved in building an immunization information system. First of all, you need collaboration among many stakeholders and interdisciplinary communications. Because of course, where do immunizations occur? Typically, they do not occur in the health department. They occur in clinician offices. So you need to collaborate with the clinicians to help them to be more effective in administering immunizations. And of course, you have to figure out a way to collect the data from them when they do administer immunizations. There are legislative and policy issues that have to be dealt with, for example, privacy. There are funding, sustainability, and governance issues. And one of the things that I'm insistent on with any information system that I'm involved in, I want to understand at the beginning how it is going to be sustainable. Because building an information system that is not going to be sustainable is a complete waste of time and effort and money. You have to have high quality data, and you have to monitor the quality of the data. You have to have a good system design and an effective information architecture. Of course, we've talked about the elements of that a few minutes ago. So those are some of the issues around immunization information systems. So I have a couple of slides about continuing challenges to public health informatics. And so in 2001, now over 20 years ago, a consensus conference on public health informatics recommended that public health informatics create an information architecture that includes a longitudinal, person-based, integrated data repository. And the 2008 definition of what's called a health record bank is an independent organization that provides a secure electronic repository for storing and maintaining an individual's lifetime health and medical records from multiple sources, and assures that the individual always has complete control over who accesses their information. So I would assert that this health record bank is really the response to this 2001 public health informatics recommendation. And if we had such things, the health record bank could be the source of complete and timely reporting to public health of everything of relevance that's going on in the medical care environment. Other public health informatics challenges include privacy. This remains a key issue. And that same meeting in 2001 also recommended in the US to create a National Privacy Advisory Committee, which has yet to be done. And also the two-way flow of data between public health and clinical care. And so the vision here is that there would be the disease report daily for physicians. I'm sure many of you have had the experience of having some minor symptoms and going to see your primary care provider and being told, well, that's going around in the community. Well, the reality is they have no idea what's going around. And whatever they're telling you is based on a statistically insignificant sample of patients that they're seeing in their office. Wouldn't it be wonderful if they could actually know that? And they could if we had the information. And then management of public health emergencies using informatics. And I think the deficiencies there were shown clearly in the COVID pandemic. So I would argue that informatics is key to healthy communities and requires closer integration of medical care and public health using IT through public health informatics, and protecting us from disease through earlier detection of outbreaks, more effective monitoring of disease patterns. Also, we need health information infrastructure, these health record banks that I talked about, so that comprehensive healthcare information for individuals is always available when and where needed. And I will say as an aside, that would tremendously improve medical care as well. And also would allow the distribution and use of the latest guidelines and research so that those could be used in patient care. So here are some resources, and I assume my slides will be available to you, so I hope you don't have to copy this down right away. There's a chapter in the Biomedical Informatics textbook, Shortliff and Semino's textbook, chapter 18 in the most recent edition, on population and public health informatics. There's also a whole book on public health informatics and information systems edited by Magnuson and Dixon. And finally, there's an organization called the Public Health Informatics Institute. The goals of that organization, which is based outside of Atlanta, is to foster collaborative information system development by multiple public health agencies to meet shared requirements, to facilitate exchange and distribution of successful information systems among public health agencies, and to avoid reinventing the wheel. And if you're interested in more information, you can look at phii.org for more information. So in conclusion, public health depends on information and information systems. Tremendous progress was made in improving health in the last century with the limited use of information technology. But continued rapid progress depends now on improved information systems developed using the principles of public health informatics. So I'll stop there, and I'm happy to take questions. Thank you for your attention.